Hi, so today we're talking about how to identify what the question is asking you. Now, this is really important because a lot of times the reason why you may not be doing well or performing well when it comes to practice questions is because you don't have either, enough content knowledge, but then also you may not have the right interpretation of the question. So what did I notice? Whether it's because of a language barrier, whether it's because it's just been a long time since you went through school, a lot of test takers that struggle to, prepare for the exam and pass their exam, the issue really is because they're not interpreting the question correctly. So if you want to improve on your practice exam scores, you want to fix your interpretation of the question, right? Because I can see a question and I believe it's saying this when in reality it's saying something totally different. And your goal before you take your exam, I recommend your goal is to have at least 75 to 80% on your average exam quizzes scores before you take your test. That's how you can take it with a lot more confidence. So let me go over with you, how to identify what the question is asking you. Okay, so the first thing is looking at, asking yourself these 5 questions that will help you to really identify what the question's actually asking you. First question is, what are the key words in the question? Right? So what are the significant words that make up the question? Keywords are usually um, the disease process, signs and symptoms, procedures, labs, and then anything that relates to what you're supposed to do. Number 2, is there an already assumed diagnosis? So there's the way that questions are formulated is that there's either one of two things that happens. One, it tells you the diagnosis, and if it tells the diagnosis, then there are certain expectations you should already have when choosing the answer. Or the other option is that it will tell you symptoms, and then you have to do your critical thinking and identify what the diagnosis is. So a lot of times the reason why people are answering the questions inappropriately is because you're not aware of the expectations of either situation. So if it gives me the diagnosis, then I have to think about what are all the expectations of that diagnosis and then pick the right answer, right? And then 2, if it doesn't give me the diagnosis, but it gives me symptoms, then you have to critically think, okay, which diagnosis is this? 3, what do I know about the main phrase or the diagnosis? It's not always the diagnosis, but I put main phrase to substitute for the diagnosis, the procedure, the problem that they're having. What do I know about that? And then 4, based on that, which answer choice directly reflects what the question is asking me, right? Which choice now reflects that? And then 5 is, after I figure that out, after I've gone through those 4 steps, do I have the correct interpretation of what the question is asking me? Right? Do I have the correct interpretation of what the question is asking me? Those are the 5 steps you want to do. So let's go ahead and do a practice question to imply this. Question says, a nurse is reviewing the complete blood count of a child who has been diagnosed with idiopathic thrombocytopenic purpura. Which of the following laboratory results should the nurse report immediately to the physician? A platelet count of 30,000, B, a hemoglobin level of 7.5, C, a reticulocyte count of 6.5%, or D, an eosinophil count of 700 cells. So you can go ahead and stop the video if you want to stop it right now. But we're going to go ahead and review how to answer this question. So let's do the very first step that we just learned in our 5-step process is what are the key words in this question? So your keywords is going to be the diagnosis, idiopathic thrombocytopenia purpura, laboratory result, and then remember, what do we do? Immediately to the physician. So what are we going to report immediately to the physician? So now I know my keywords. Then I ask, what do I have an assumed diagnosis? Yes, it didn't give me symptoms. It gave me the diagnosis already. Number 3, what do I know about this main diagnosis? This is the part now where you make the right connection. So idiopathic, idiopathic pretty much means that word by itself, idiopathic, is not knowing the cause of something. So idiopathic thrombocytopenia purpura is pretty much low platelet counts. That's it. And what low platelet counts manifest in the body or can manifest is a risk for bleeding. That's what I know, right? So, and that means I already have the expectation that they're going to have low platelet count, right? So now the fourth step is which answer directly reflects what the question is asking me. So if I know that idiopathic thrombocytopenia purpura is low platelet count, why would I tell the doctor that the patient has low platelet count? Because we already know that. So that's why A is not the correct answer. So it says immediately. So immediately implies that something different or wrong or abnormal is happening. So once again, we just established that thrombocytopenia purpura is low platelet count, which can manifest bleeding risk. So B is the only one that I would tell the doctor, because B indicates that they must be actively bleeding, because the normal hemoglobin is 12, right, for women and 13 for men. So if it's 7.5, that means they're bleeding right now, and they're probably going to need a blood transfusion. So B would be the most appropriate answer. A, C, and D are all expected with thrombocytopenic purpura. So you see how I got to that? And I simply got to that because I was able to break down the appropriate and the accurate interpretation from going through those 4 questions that I asked myself. So sometimes the reason why you may be struggling with the questions, it's just really a matter of your ability to ask yourself the right questions that will lead you to the correct answer. If you take advantage of our Nclux prep program, we literally have a quiz at the end of each section or unit of the program, and you can be able to take the quiz, and then also you can also download the answer key that comes with each quiz. In addition to the quizzes, there's also as well a pre-exam that you're going to take at the beginning of the program, and there's also a midterm exam, and there's also a final assessment exam. So in addition to that as well, in the program, there's also trainings where I kind of show you and help you to better understand and listen to how to appropriately answer and break down questions. We have testimonials of people that have been successful with the program after failing their exam multiple times before. Simply go to www.solidstepstoNclustSuccess.com to get started right now. And then you can go to bit.ly/passNclux to schedule a free Nclux phone consultation. All right, that's pretty much it. Thank you so much for tuning in, and I'll see you the next time.